And I'm so glad to have you here. My name is Patricia Gakonde and I'm your host. Now, we took January off just to plan forward for content, so that we can have value for you into this year. And I'm so glad that we did that because we are prepared now to bring you so much content around neurological conditions because we want to have awareness, right? And we want to also create a space where people who are already navigating these conditions can have a space to just, come in and share their stories, even relearn some of these things. So yeah, karibu sana. Let's have a conversation. Now, last year we had many episodes with caregivers, and we got to sit in and listen to their stories. Some were heavier than others, but you know, at least we got to have their journey, opened up to our eyes, and we were able to see what type of life that they live with, and we got to see what life or journeys that they have within their lives. And yeah, that was beautiful. Now, there are many issues that were spoken in these episodes, many that we weren't able to deep dive because you want to give people space to just share out their stories without having to internalize them. And now that we want to have a series where we are going to be recapping some of those issues and just getting into the deep dive of these issues so that we can understand them and not have issues just being spoken in the stories and we never really go back to understand what was said. So today I'm particularly going to focus on Susan's story. If you could go back and just watch Susan's stories if you haven't. And Susan is a very vibrant lady who has a child by the name Gloria. Gloria was diagnosed with brain atrophy. And there's one thing that Susan shares in the episode where she says her pregnancy was very healthy. She went to the clinic as per usual up until delivery, where now she had prolonged labor. And that was how Gloria was, had respiratory distress and therefore ended up being diagnosed with brain atrophy way later. So that caught my attention. You might think you have a very healthy pregnancy, and then now when it comes to delivery, that's when a risk happens and you end up with a baby that has a neurological condition. So today we're going to be focusing more on those risk factors, and something I want us to note is that we have risk factors that happen before pregnancy or even before conception, and then we have risk factors that happen during pregnancy, and then we have during delivery, and even I think the end is during delivery, right? And so risk factors are basically the events that might happen during these periods and that will end up getting you into a place where you have your baby that will be diagnosed with a neurological conditions. The reason as to why we would have this conversation, not necessarily to have somewhere to put blame or somewhere to throw fingers at, but it is just for our awareness, so that even those ones that are looking into starting families or even getting pregnant can have a space where they've had these things, right? Because most of the caregivers that we talked with mentioned that they had never ever come across a neurological condition or even had education around it or awareness around the things that could happen and could cause them to even end up with a baby with a neurological condition. So this is why we're having these conversations, not to blame anyone or not to put blame on anybody, just to be able to understand. And so now that we've talked about having risk factors before pregnancy, let's focus, let's come into that. Before pregnancy, you would think maybe you're fine to have read, most people, I'd assume, conceive even without necessarily having have planned, right? So let's go to that point where you have no idea you're pregnant, or even if you're probably planning what are the things to look at. So one of the risk factors is a health condition that you may have, or one that you haven't even been diagnosed with yet. Okay, so it is important for you to have health checkups. We know that yearly it is advised that we have health checkups so that we know the condition of our bodies. Now I want you to imagine you want to conceive a baby, or you want to bring someone new into a house, right? The first thing to do is to make sure that the house is healthy, or where this person is going to come in is healthy, right? And so you, as a mom or somebody that is expecting to be a mom, have to be aware of your health conditions. Let's say you have something like anemia. And we're not saying health conditions are bad and so you can't have babies because you have a condition. It is just that we want us to focus on the fact that we have these conditions, or we have a health condition, and so we need to be able to understand what steps we can take to make sure that our pregnancy is healthy. So let's say you have anemia, right? And this house you're preparing and this guest that you're going to be having needs a lot of oxygen to operate and to form, right? And so if you're going to have them come in with a house that is anemic, you're going to have to know what to do to ensure that they have the best supply of oxygen, or enough supply of oxygen. So if you have a condition such as anemia, it is important that you visit, a doctor, so that you are directed into how you're going to take care of this, new guest that you're going to be having, right? So health conditions are risk factors. It could be diabetes as well. It's anything, any condition that makes it even more difficult for the baby to survive during the pregnancy. So that is something that we have to check, right? And then another risk factor before pregnancy is the lifestyle that we are living. I know this is going to be a long conversation, but I'm going to try not to bring it into that. But all you're trying to say is the fact that you want to, again, bring in the visitor. You have to make sure that the body that, or the house that you're going to house this visitor in, is healthy, right? And so some of the lifestyle that we have before pregnancy, and I mean, having drugs, having stuff like, excess alcohol or things like that, we know that they can affect our health in general, right? And so now imagine you're going to bring in a baby, or you're going to house a baby in, a house that's affected by drugs. All I'm trying to say here is that we should definitely consider a healthy lifestyle before, we bring the baby in, right? So that is before pregnancy. During pregnancy, we also have risk factors, right? Oh, before I go into during pregnancy, there's also one risk factor that I am forgetting, and that is the age. And we're not saying that, younger people should not get pregnant, or older people should not get pregnant or look forward to have a baby. They should, hapo kwa young, we can debate. But the age of the body, and this is going to go into the biological clock and stuff like that. If you're a body that has not developed yet, you cannot house a baby healthy, right? In a healthy manner, because you need your body to be 100% for you to be able to bring in another body, right? So if you're young, if you're very young, if it's a teen mom, there's a risk factor there of ending up with a baby who has a neurological condition, because your body is not, the capacity of your body is not to a point where it can, be able to house another baby, right? Because you're a baby. Also, for older women, and we are talking about, over 35 or, over 38, by this time, your body has probably accumulated, some health issues and some health conditions, say diabetes, and, there's more fat around your capillaries because of the calories you've consumed over time. And So this then poses a risk to how your body will operate during pregnancy. So we are not saying that now these people should not be looking forward to have kids. It's just that you should go into the awareness that there are risk factors surrounding, your age and how biology works. So you should be able to ask for help. You should be able to go into appointments and ask your doctors what it is that you can do to make sure that you have the right environment for your kid to grow in you. Now let's get into during pregnancy. We have factors during risk factors during pregnancy, and there's one obvious one, which is physical factors. You need to be able to have a pregnancy where you have not been hit physically, or in case something as such happens, you quickly intervene and go check with the doctors. So in case you trip, in case you have a physical object hitting your stomach, or just anything physical that has happened that is extreme, say maybe you fell, these are the risk factors that can happen, or these are events that can happen that would eventually lead to your baby having a neurological condition. So in case some of these things happen, you should be able to you should be able to go to the hospital and check on the baby, get scans. They will advise you on how to do that during pregnancy as well. In as much as we've talked about lifestyle before pregnancy, the lifestyle also during pregnancy is very important. We all see women not drinking alcohol when they're pregnant, and this is because you want to make sure that whatever it is that you're feeding the baby, or whatever it is that is being received in the baby, is something that's healthy. So in case you have a lifestyle that's not necessarily producing a conducive environment for your child, you're most probably gonna end up risking the baby into having a neurological condition. So during pregnancy, make sure that you're safe, make sure that nobody's hitting you. Okay, make sure that anytime something like that happens, you are able to go into a hospital and get checked. So another factor, Susan talked about attending clinic every now and then, right? A pregnant woman is advised to have antenatal care, and this is for a reason, right? You need the attention of a doctor. You need to check your progress over time. You need that attention. So going to clinics, having antenatal care, they give you, things like iron and supplements, just to make sure that the environment in which your baby is growing in has all that is needed to make sure that that happens. So it is important that we do antenatal care. So it's a risk factor to not have your clinics, right? So if you want to have a healthy pregnancy, the moment you realize that, oh, I am pregnant, you should be able to go to the hospital so that you can continue to have antenatal care. So another factor during pregnancy that maybe we don't often talk about is high stress. Okay, so high stress may cause something like blood pressure, and again, we've talked about having a healthy environment in which the baby is growing in. So high level stress, high cortisol will lead into having a condition where the baby is not receiving enough care that they need during the pregnancy. So it is important that when you are pregnant or during pregnancy, you try your best to manage the stress levels, right? Stress levels should be down. If you're feeling sad, go for a walk. If you're in a situation where there's a lot of stress happening, maybe it is best that you move from that environment and go into a more safer space where you're going to have more happy hormones than cortisol. That's all I'm trying to say. So high stress levels do have an effect during your pregnancy. So Susan did talk about having prolonged labor, and this is a risk factor because when you have prolonged labor, it means that there's a lot of physical demand to you and to the baby as well. There's a lot of physical engagement, and therefore if it is prolonged, it means that the baby is most probably going to have less supply of oxygen, and again that leads to insufficiency, of the oxygen, and therefore brain forming will be difficult because the baby needs that oxygen to form, right? Now, what can be done to prevent prolonged labor? Maybe you can be able to know when you're going to be delivering or when to expect your baby, so that when you start laboring immediately you can seek attention, or you can rush to the hospital. Also, for the medical experts, when somebody comes in, they can be able to monitor you and even say, maybe this is too prolonged, we can intervene early. So delayed intervention also is another risk factor here. If they intervene very late, then again the baby would have lacked oxygen and therefore leading into a neurological condition. So these are just some of the risk factors that we have. I'm pretty sure we have more, but it is important to be aware of them so that you can be able to intervene early and you can be able to have solutions for some of them. And this is not to say that the ones that have already gotten to a position where that happened and now they have a child with a neurological condition, we cannot necessarily blame them. And this is why we are bringing this conversation to you, so that you can be aware. It is important that we talk about this. It is important that we bring these conversations to you, especially for those that can't necessarily access education, can't necessarily access some of the materials that are out there. Because if you Google, yes, you will find this information out there, but then we are trying to bring it closer to home. So do share this conversation, do share with your friends, do share with people who are going to benefit. And I believe everyone is going to be of benefit of this conversation, right? I think we can end this episode there. And I hope that it has been of value to you. And I hope that even as we continue to recap some of these episodes, that you will join us again and again, that we can have attention to these matters. Now, that has been me, and I hope you learned something. Well, I have learned something as well, and we are going to continue to learn, right? I'll see you on the next episode. That has been me, Patricia Gakonde. We can now resume into having popcorns and something else. Anyway, please share, subscribe to this channel. Let people come in and listen in. Let us be educated, right? All right, I'll see you on the next episode. My name is Patricia. Bye.